The Guam chapter of the Society of Human Resource Management hosted its annual one-day conference at the Marriott Hotel to specifically focus on federal healthcare reform. Calvo's Select Care Health Plan Administrator Frank Campillo was one of the panelists in health insurance discussions. He says they are discussing the issues that will affect businesses since the Reform Act was passed in March and first implemented in September.
The human resource managers would like to know, how is this going to affect my business? The purpose of today's panel, and we have all the health insurance companies on Guam presenting, was to kind of show or share with them what some of these new changes will mean as far as costs, as far as benefits, and what would happen in the future.
Campillo also says the side effect to the new law is that more companies are leaving the health insurance business. He mentions rates are increasing not just on Guam, but nationwide, adding that the state of Connecticut approved a 47% increase and that even Saipan is dealing with higher costs.
Some of the unintended consequences of this law has been that we've seen rates increase not only on Guam, but also nationwide. In fact, we have somebody here from Saipan, which I would appreciate if you interview, who just shared with us that the government of Saipan is being given a 32% rate increase for their health insurance. Now, on Guam, as you know, there's been a lot of commotion about a 300% rate increase. That was never the case. The rates for Guam never increased by that much.
On the plus side, officials from the Department of Public Health say the new law doesn't affect MIP but will provide additional money for the Medicaid program if Guam can match the dollars. Healthcare Financing Administrator Teresa Archangel says there will be changes to some benefits and eligibility requirements, but Guam will be getting over $8 million at the end of the first quarter of this fiscal year and about $32.5 million each year until 2019.
That's additional. That's in addition. Currently, a regular Medicaid has 14.24 million. So that's in additional. And each year, it increases based on the Consumer's Price Index, the Medical Consumer's Price Index. So by then, if the government can match the federal grant, then we'll have a lot of money under the Medicaid.
So it's good news for Medicaid.
Yes, it is.
Campillo adds the four major insurance companies have also recently formed the Guam Association of Health Plans, electing its new president, Don Davis. Campillo says their goal is to figure out how to further address concerns with the new law, contain costs, and ultimately provide affordable health care services to the public.
Evidently, it would be best for us to try to have rates that are affordable by the general public, because if our rates are affordable, we will have more and more people insured. Unfortunately, rates don't depend on our actions. We depend on the actions of others.
Josh Tikenko, PNC News.